infection with PCUA. Like I said before, in this video I will be talking about HIV. What is HIV? The human immunodeficiency virus HIV infects cells of the immune system, destroying or impairing their function. Infection with the virus results in progressive deterioration of the immune system, leading to immune deficiency. The immune system is considered deficient when it can no longer fulfill its role of fighting infections and disease. Infections associated with severe immune deficiency are known as opportunistic infections because they take advantage of a weakened immune system. What is AIDS? Acquired immune deficiency syndrome (AIDS) is a term which applies to the most advanced stages of HIV infection. It is defined by the occurrence of any of more than 20 opportunistic infections or HIV-related cancers. How is HIV transmitted? HIV can be transmitted through unprotected sexual intercourse, vaginal or anal, and oral sex with an infected person, transfusions of contaminated blood, and the sharing of contaminated needles, syringes, surgical equipment, or other sharp instruments. It may also be transmitted between a mother and her infant during pregnancy, childbirth, and breastfeeding. How quickly does a person infected with HIV develop AIDS? The length of time can vary widely between individuals. Left without treatment, the majority of people infected with HIV will develop signs of HIV-related illnesses within 5 to 10 years, although this can be shorter. The time between acquiring HIV and an AIDS diagnosis is usually between 10 to 15 years, but sometimes longer. Antiretroviral therapy, known as ART, can slow the disease progression by preventing the virus replicating and therefore decreasing the amount of virus in an infected person's blood, known as the viral load. What is the most common life-threatening opportunistic infection affecting people living with HIV? Tuberculosis, known as TB, killed 400,000 people living with HIV in 2016. It is the #1 cause of death among people with HIV in Africa, and a leading cause of death in this population worldwide. How can I limit my risk of HIV transmission through sex? It's very important to use male or female condoms correctly each time you have sex. Take antiretroviral drugs for pre-exposure prophylaxis of HIV. This is known as PrEP. Practice only non-penetrative sex. Remain faithful in a relationship with an uninfected, equally faithful partner with no other risk behavior. Does male circumcision prevent HIV transmission? Male circumcision reduces the risk of female to male sexual transmission of HIV by around 60%. A one-time intervention, medical male circumcision provides lifelong partial protection against HIV as well as other sexually transmitted infections. It should always be considered as a part of a comprehensive HIV prevention package and should never replace other known methods of prevention such as female and male condoms. How effective are condoms in preventing HIV? When used properly during every sexual intercourse, condoms are a proven means of preventing HIV infections in women and men. However, apart from abstinence, no protective method is 100% effective. What is the benefit of an HIV test? Knowing your HIV status can have two important benefits. If you learn that you are HIV positive, you can take steps before symptoms appear to access treatment, care, and support, thereby potentially prolonging your life and preventing health complications for many years. If you know that you're infected, you can take precautions to prevent the spread of HIV to others. What are antiretroviral drugs, known as ART? Antiretroviral drugs are used in the treatment and prevention of HIV infection. They fight HIV by stopping or interfering with the reproduction of the virus in the body, reducing the amount of virus in the body. Is there a cure for HIV? No, there is no cure for HIV. But with good and continued adherence to art, the progression of HIV in the body can be slowed to a near halt. Increasingly, people living with HIV can remain well and productive for extended periods of time, even in low-income countries. The World Health Organization now recommends treatment for all people living with HIV. With this, I finish this topic about HIV. If you have any questions, please leave a comment and I'll address it in another video. I hope you guys like this video. See you next time.